Hi, I'm Dr. Steve Grinstead, author of the book Freedom from Suffering, A Journey of Hope, and someone living with my own chronic pain for over 30 years. You know, this past week has been a bit challenging for me. I've had several major rebound episodes, one that lasted almost 2 days. And it took me back to the early part of my pain management journey when I was suffering from lower back pain, and I do mean suffering. Fortunately, it's been over 28, 29 years now since I've had to suffer with my chronic pain. But every time I get a bad migraine episode, it takes me back to the same feelings that I started to experience back then and puts me at risk for entering what I call a chronic pain trance. Now, part of the chronic pain trance is developing a state of mind where I feel hopeless and helpless. A lot of people I've worked with over the years have really hit this trance state, and part of it is the need to go through a grieving process. I know for me how important that was because at one point in my chronic pain trance, I thought my life was over. Why should I even go on? And fortunately, I had a lot of people in my back that were saying, Steve, come on, let's go. They came to my house when I was unable to get out of the bed and out of the house for a while. When I was able to get up and around, they helped take me to support group meetings. They were there for me. And then I started working with a therapist that helped me work through my chronic pain trance. It was an important part of my recovery journey. And going through a grieving process is so crucial. If you're watching this on YouTube, please go to the link below for my personal blog and learn more about the role of grief and loss in chronic pain management. Going through the stages of a grieving process is so important, and I want to support everyone in getting help to do this. Living with chronic pain is challenging, but when you're also suffering from the chronic pain trance, it becomes even more challenging. This is where a lot of people get in trouble with over-medicating because they start medicating the psychological, emotional symptoms, and eventually, for some people, 10 to 15% of the people that are on chronic pain medication, they can develop problems. They can develop unusual tolerance buildups. They can have abuse where they're misusing or abusing their medications or taking other things with the meds they shouldn't be. Some people can get into a state called pseudo-addiction. Pseudo-addiction is basically undertreated or mistreated chronic pain, and where the symptoms look a lot like the next stage, which is addiction. A lot of people do develop addictive disorders who are on chronic pain medication. It doesn't have to happen. And part of the process is learning to deal with the chronic pain trance and resolving the grief and loss issues about your prior level of functioning and your quality of life. Reintegration stage of this grieving process I talk about in my blog is crucial. It's where I honestly, for me, got to the point where I can say, today, my life is better than ever. Yeah, it's different. I'm not doing construction work anymore. I'm not teaching martial arts. And I am really excited about the new path my career has taken. And it's more of an avocation than a vocation. It's something that brings me passion and excitement when I can help other people move out of the problem into the solution and achieve their own freedom from suffering. And I definitely believe that freedom from suffering is every person's right, but it's also a responsibility. When I work with my pain patients, I promise them, if and only if they're willing to do the hard footwork, they'll never have to suffer with their pain again. And it does work. Please, again, check out my personal blog at the link below and learn more about freedom from suffering by going to freedomfromsuffering.net. You'll be able to download a free e-workbook exercise, part of which talks about the chronic pain trance. I really want to be there and support you, and please let me know about your journey so I can talk about it in my future blogs. Thank you.